Now we want to turn to an expert on these chemicals. When you heard me talk about what they were, many of you might be like, what exactly is that? And so we want to give you a clear breakdown of what the chemicals are and how they can impact residents, what that potential impact would be. And for that, we are going to turn now to Dr. Jill Michaels with the South Carolina Poison Center to give us a closer look. Dr. Michaels, thank you for joining us this morning.
Yeah, good morning. Glad I could talk to you.
Thank you so much. Now, can you describe the types of chemicals and the substances involved in this accident?
Yeah, these are what we call caustic chemicals, and so they can cause a lot of irritation and burning, and it depends on how you're exposed and how much you're exposed to. If it gets on the skin, it can irritate, actually burn the skin. The same thing with inhaling the fumes. It can be a little irritating depending on the concentration. It might cause some eye watering, nose burning, throat irritation. But in high concentrations, it certainly causes coughing, wheezing, what we call bronchospasm, where people have trouble breathing. And so people who may have some health issues like asthma or other breathing issues may be more prone to having some symptoms if they get exposed to these substances.
And Dr. Michaels, at what levels of exposure do these risks become serious?
It depends on the symptoms for the person. If they're having trouble breathing, they're coughing so much they can't speak, they feel like they're not getting oxygen into their lungs, then that becomes a problem and you need to seek medical attention.
And are there particular populations who are more vulnerable in this situation?
Yeah, certainly people with COPD, asthma, so emphysema, more like breathing lung issues, they could be predisposed to having, less of the odor or the exposure could cause them to have more symptoms than the typical person.
And what will decontamination look like when it comes to cleaning up this incident?
That would be a hazmat. They're the ones who are going to, for the physical environmental aspect of cleaning it up, so that would be the hazmat that would take care of that. The Poison Center usually just deals more, with the people aspect of it, so hazmat would be in charge of the cleaning it up.
And when you're speaking to people in these type of situations, what do you talk them through? What does that conversation look like? Because I can understand if you hear these chemicals, there could be some concern. So what would a conversation look like for folks in that area who call the Poison Control Center?
Sure. Follow what first responders are telling you to do, whether it's to evacuate or to shelter in place if you need to, keeping your windows closed. Sometimes they also say, well, turn off your HVAC system. So whatever they're telling you to do, heed the warnings of the officials. For people, if they feel like they've been exposed, we're certainly going to ask what symptoms they may be having. And then depending on the situation, if it warrants them to go to the hospital or go to urgent care to be checked out, they can always do that as well if they feel like they're having symptoms from the exposure.
And continuing on that note, after the emergency is over, because we saw there was a very large law enforcement presence, official presence, they are working to contain this. What follow-up or monitoring might people need for this incident, if any?
Yeah, they can certainly follow up with their doctor about it or contact the officials. I don't know if there will be any after the fact. Sometimes they do follow up with people in the evacuation area for any kind of long-term effects. They do that sometimes in these large-scale events. So they could follow up with the town officials to see if there's going to be any follow-up or any kind of discussing after the fact, but moving forward what to do.
And based on your experience, what type of concerns do you see people typically have when it comes to being involved in this type of incident? Specifically, I'm talking about the residents in this area.
Yeah, I mean, it's scary, right? You're potentially exposed to a chemical you don't know much about, and so it certainly can cause a lot of anxiety and angst over being in that situation. But we want to, again, make people aware that these are irritating gases that if they're breathed in, they can irritate the eyes, lungs, nose, and throat. And depending on the severity of the symptoms, to seek medical attention for those symptoms.
Now, is there anything the public might misunderstand about poison exposure, or is there misinformation that sometimes gets out there that really causes more panic and fear than needs to be? We want to go ahead and nip any misinformation in the bud now, because we know how, especially on social media, these things really turn into a whole different story. So based on your experience, what type of misinformation could possibly come from this that we can go ahead and alleviate any of those fears?
Yeah, I mean, the main thing is following up with the news, right? Because you're getting information from the local authorities, and you want to follow the local authority information. What you read on social media posts from the neighbor who's down the street or in the other city, who's not even near the area, that's where the panic occurs, where they heard it happened to somebody, or they heard this what happened. You know, you follow with the news, follow with the first responders. They're going to give you the correct information. I wouldn't go on TikTok to find information about this unless, you know, the city of Cayce has a TikTok page. You know, there all these hazmat, they usually have some type of social media presence. The city of Cayce is going to have, you know, a social media presence. So go to those sites if you're going to look for information on social media.
Absolutely. Retweet that, Dr. Michaels, for sure. And my final question for you regarding this incident, any other advice that you would give or encouragement that you would give to help calm fears but ensure safety in this situation?
Yeah, you know, the Poison Center is available to call and talk to. We are, you know, a free confidential service, 1-800-222-1222. We're staffed by nurses and pharmacists, so we're also out there when these things happen for people to call and ask questions about. So if they would have any questions, so certainly the Poison Center, their healthcare provider, those are people who are going to give you the correct information.
All right, Dr. Jill Michaels, thank you so much for joining us and helping clear that up and provide some really good background on these chemicals and how we can respond safely and accurately to this situation. Again, you just heard from Dr. Jill Michaels, the Managing Director at Palmetto Poison Center.